Show will cover the effective communication methods between a healthcare professional and a patient, one specifically from the deaf community. It is worth noting that the deaf community includes people with varying degrees of hearing loss, including those that are completely deaf and some that have slight hearing loss. When walking into a patient's room, introduce yourself and exchange pleasantries so the patient feels more comfortable. This not only establishes who you are, but makes the patient feel more welcome and establishes that you have the right patient. The next step is establishing a way that the patient feels comfortable communicating. If the patient is part of the deaf community, this step is incredibly important. Some methods of communicating within the deaf community are through spoken English and lip reading, writing, signing, and any type of sign that the patient is native in using, or even using an interpreter or translator. It is worth noting that these methods are effective communication tools for any type of communication, not just communicating with people within the deaf community. Hard of hearing individuals may have varying degrees of hearing loss, which makes it possible to communicate using spoken English if that is what the individual prefers. However, if this is not the method of communication the individual wishes to use, then the physician or healthcare professional should use the method of communication that the patient prefers. Lip reading is the ability to understand what's being said by observing a person's lips, facial expressions, and body language. Many children who are born deaf are taught from a young age to recognize body language and facial expression of varying emotions and attitudes. These children are also taught to lip read basic conversational vocabulary such as hello and how are you. In lip reading, it looks something like this. However, it has been documented that only 30 to 40% of any spoken language can be fully understood by lip reading, and accents, unfamiliar words such as medical terminology, and unfamiliar speaking habits can make lip reading very difficult. If lip reading is a patient's preferred communication method, then the physician must make sure that they are in a well-lit room, they face the patient, making sure there is nothing interfering with the patient seeing their face, such as the glare from a window or facial hair, and they should speak at a natural pace so as not to exaggerate words. Deaf individuals have a limited access to spoken communication, so written information is the number one way in which they receive information. As such, most writing should be done in a conversational way that excludes formal grammar and medical terminology. Write in a way that is also neat and legible. The patient should not confuse any of the letters for other letters or even numbers in your handwriting. Writing in an unclear manner can lead to misinformation and possibly mislead the patient into falsifying information. However, while the healthcare provider may find that this is an effective form of communication, people have varying degrees of education, which makes it necessary for the healthcare provider to use clear and concise language. If possible, a translator can be used for the varying differences in grammatical structure when writing, as many sign language users will understand signing grammar structure compared to written grammatical structure. As seen in the slide, it can be seen that Steve and I went swimming yesterday in a written structure. However, in signing structure, you would sign swimming yesterday with Steve. The deaf community in the U.S. mainly practice American Sign Language, or ASL. However, this language developed from French Sign Language and evolved from local home signing methods used at the time. As such, ASL is different by region within the U.S. and differs by family and how they sign. The Black community also has their own way of signing, referred to as Black ASL, that has similar signed words to ASL, but they are often signed in a bigger way outside of what most linguists would refer to as the signing square in front of the body. Seen in this image here, the traditional signing square is from shoulders to the waist, whereas in Black ASL, the signing square is all above your head to below your waist and outside of your body. As seen in the last slide, signing has its own form of grammatical structure that only those who know the language or interpreters will recognize. This often means that unless the healthcare provider is familiar with sign, they will often not understand any sign and may seek the aid of an interpreter. If the health provider does recognize some sign, then they are usually welcome to open communication in this way. But if there is a lack of understanding between either the healthcare worker or patient, then other alternatives to communication may need to be used and should definitely be used. Signing should be performed in an open, well-lit space so both parties have room to express themselves and can see each other clearly. One person should sign at a time so everyone involved in the conversation understands what is being signed, and facial expressions and body language are encouraged as these are a proper part of signing. There is a major difference in interpreting and translating and when either an interpreter or translator should be used. An interpreter is a person who takes the spoken language and converts it into a sign language and vice versa for the parties involved. A translator is a person who takes a written language and converts it into a sign language and vice versa for the parties involved. When using an interpreter, it is important for the healthcare provider to act as if the interpreter is not even in the room, as any communication should be directed directly at the patient. Never ask the interpreter to tell the patient something, always ask the patient directly and let the interpreter translate. Provide any appropriate space or lighting, speak at a normal pace. If you are in a group, take turns with the people speaking as to not overwhelm the interpreter or the person receiving the information. And always remember to address the patient. If you have the ability to inform an interpreter ahead of time of what they will be translating and this topic does not break HIPAA law, then you may prepare the interpreter so they have time to prepare for the event. When in doubt in any situation, ask the interpreter or translator what is the best way to proceed in communicating. Overall, any communication method takes practice, and everyone involved in this process needs to remember to maintain patience.